We all have our bad days. The only problem is, it's actually a whole lot of us. Some surveys even reveal that since the pandemic alone, about 90% of young people in the country admitted higher anxiety, and search engines were buzzing with conversations around therapy and trauma.
गुस्सा था, चिड़चिड़ापन था,
डिटैचमेंट
मुझे बुरा लग रहा था।
मुझे लोग समझ नहीं आते, सोशल बिहेवियर जो है वो मुझे समझ में नहीं आता।
Surprisingly, despite so much crime and violence around us, the likelihood of us dying by suicide is actually twice than someone else killing us. In fact, suicide is slated to become the highest life taker in the world by 2030, more than wars, violent crimes and terrorism put together. So, how can we escape this fate? More psychiatrists. With less than one psychiatrist for 1 lakh right now, to get this ratio to 1:100 would be an impossible task. And the solution mostly boils down to prioritizing ourselves with better exercise, diet and meditation. But then, if we had this kind of self-discipline in the first place, we wouldn't be in this soup, would we? And the worst is our addiction to technology and connectivity, which further fuels approval anxiety, jealousy and conflicts. So, how do we stop the human civilization, especially young people, from sinking into the quicksand of depression? Perhaps if we could manage a shared experience to achieve collective well-being or Saath Nirbhar.
As youth workers, we knew that collective well-being had to be a key imperative in our COVID response. At the height of second wave, members of VartaLeap Coalition and ComMutiny-vartaLeap Collective designed an innovation that would help people across generations to transform negative feelings into the ones that are positive, interdependent. The Innovation Lab was a mix of mental health professionals and youth work experts. Soon after, UNICEF Yuva and other collaborators came forward to support the rollout of this innovation.
It is in this context that Yuva immediately responded by listening to young people and building, along with its ecosystem of partners, effective, quick, innovative and scalable solutions. And I think one of those solutions was definitely the Togetherness Table, the Saath Nirbhar initiative, because it really put at the center mental health and psychosocial well-being.
Before we knew it, it was being played all over the country. The Togetherness Table. The idea was to create refl-action space where a diverse and intergenerational mix of people would get together and engage in interesting feeling-related tasks and then share about their experiences of undergoing these tasks.
खुशी हुई थी कि इसमें बहुत मतलब बड़ी उम्र के भी थे, छोटी उम्र के भी थे, सभी लोग थे।
3 स्टेप्स हैं फीलिंग न्यूट्रलाइजेशन के। तो स्टेज 1 इंटरप्टिंग एंड लेबलिंग, सो व्हिच मींस गेटिंग इन टच विद आवर फीलिंग्स।
फिर गुस्सा, उदासीन और नफरत, क्योंकि हम फीलिंग को समझ नहीं पा रहे थे, तो अधिकतर फीलिंग ये आई थी कि हम अच्छा नहीं लग रहा है।
Through 3 stages of interruption, acceptance and switching, the Togetherness Table was designed to help each participant identify, label and neutralize their feelings. And by the time these groups underwent 3 such rounds, participants would learn how they can not only prevent depression, but also how they can cooperate and collaborate with others for creating a lived sense of collective being. This was designed around a range of tasks that the participants had to undertake during each stage, sometimes individually and other times collectively.
फर्स्ट स्टेज में आपका गोल टास्क के लिए आपको 10 पॉइंट्स दिए जाएंगे।
मुझे लगता है सिल्वर में मजा ज्यादा आएगा।
यार मैं करूं, मैं क्यों करूं, मतलब इससे होगा क्या? पर जब वो समूह में कर रहा था तो मैं भी करूं।
एक ऐसे सामाजिक समस्या या मुद्दे पर सहमति बनाए जिससे समूह में सभी जुड़ा हुआ महसूस करते हैं।
In the letter writing stage, I could see 2 boys. They had a fight about something. They were very good friends, and they wrote a letter to each other.
हमारा जो टास्क था उसमें हमें कॉल करना था किसी को और उनसे ये पूछना था वो हमसे क्यों प्यार करते हैं। मतलब ये जो टूल्स यूज किए ना, वो स्पेस क्रिएट कर रहे थे वैसा।
The exercise was designed to switch from feelings like depression, anxiety and fear to the 5th space feelings of freedom, ownership, learning, love and social hope. These conversations and tasks motivated the participants to acknowledge their own feelings, and once they were able to do that, the conversations began to be a little more empathetic. Just through November and December 2021, The Togetherness Table was organized for 108 cohorts, reaching 3,240 participants through 35 organizations and 11 locations across the country. But that's just about the scale. The real impact was in the soul, wherein participants were not just able to neutralize their feelings, but also built capacity to counter these feelings and included others in their journey. And its impact, assessed by the participants themselves, is heartwarming.
जो टॉपिक दिया गया उस पर चिंतन मनन कराया गया।
अपने आप को अच्छे से जानना, मेरे मन में क्या क्या बातें चल रही है, मुझे अच्छा लग रहा है, बुरा लग रहा है।
धीरे धीरे मनमुटाव कम हो गया।
अच्छे व्यवहारों से और शांत मन से अपनी बातें समझाने का, अपनी बातें रखने का मुझे उम्मीद जगी और मैं रख पाऊंगा।
This social experiment has proven that a structured and collective reflection on our feelings can be therapeutic, not only for the self but also for society. And the best part, the design can be replicated just about anywhere, even virtually. In fact, a digital version has been lightening the load of the lockdown on many young people over the past 1 year. What started out as a social experiment is turning out into the Saath Nirbhar movement. And over the coming years, the Togetherness Table would be reaching thousands of more intergenerational participants. It takes the whole village to keep us happy. About the time we humans, especially us young ones, recognize this simple truth.